how decay progresses. In this video, you'll have an opportunity to go to a number of other videos to see incipient decay, active decay, and nerve exposure. But at the end of this video, you'll actually see the massive decay and what's involved with that. Here's the incipient decay, and as I had mentioned, it looks just kind of like a normal area, but in this case we were able to diagnose it with the laser and tell us that it was decay. You can go to that YouTube video and see that. Here is a next level, larger area. You can see the grayness around and the brownness around the filling. Go to this video if you'd like to see how large that is in terms of the filling. The next progression would be the decay would even get larger and deeper and get closer to the nerve, and in this case it actually touches the nerve and the person's going to need some sort of work with that. There's the video that you can look to that link. On the patient of choice that we're talking about today, he has decay on the left side that looks like that, and it's a close-up of it, and you can see the white and the brown chalky area. And he had something like this on the right side of his mouth, and it ignored it, and it got larger and larger and eventually turned into this. And you'll see in the video that the area that is brown like that is loose and soft, and that's what happens when someone gets decay is that the acid softens up the tooth structure and undermines the enamel, and eventually the enamel breaks and either gets into the nerve or the person has a big chunk of the tooth break off. And there's very little that can be done in this circumstance, and the patient is going to need to have the tooth extracted, and that will necessitate usually some sort of replacement. That's the area on the left. You can see the decay is a little bit darker in the video, and here's his tooth, and you'll see the decay being peeled away. Choices for removal or replacement would be doing nothing, but the teeth would shift around and cause more problems. Also, you could have an implant or a bridge that's fixed in the mouth or a removable partial. They all have pluses and minuses, and like I said, usually you would refer an implant for that area. This is where the extraction site is. You can see the suture that's holding the gum tissue together, and that's the blood clot, and the patient's going to heal and need to decide what he should do about that space. But really the purpose of this video is to get decay at either the incipient decay or the active area before it gets into the nerve or the massive decay. And that's why someone goes to the dentist and has treatment done.